Hi everyone, I'm Anita Iyer from Ekansh Trust. Ours is an NGO that works to empower people with disabilities. Demystifying Disabilities is our video series where we speak to medical experts about prevention, detection, and early intervention, management, and treatment of different disabilities. Today we have with us pediatric orthopedic surgeon Dr. Vivek Sodhai. Thank you, Dr. Vivek, for being a part of our series.
Thank you, Anita, for having me here on this platform. And I thank you to all the complete team for inviting me for this interview.
We are happy to have this question. What are the disabilities related to your field of expertise? You are a pediatric orthopedic surgeon. So whether it is pediatric or otherwise, can you tell us what are the different disabilities that you come across on a daily basis related to bones that are genetic, especially?
So, in pediatric orthopedics, I constantly work around disabilities that are caused by cerebral palsy, the congenital limb anomalies, and sometimes post fracture or post infection if there has been any destruction of the bone that has been caused, which has led to a bone shortening. I deal with them constantly.
And genetic, what are the most common disabilities related to bones?
So most common deformities related disabilities related to congenital issues are congenital talipes equinovirus, which is commonly known as clubfoot. This is the
Okay.
most common deformity in children, which is seen frequently. And the second most common deformity is the developmental dysplasia of hip, which is a congenital dislocation of the hip. These are the
Okay.
two most common congenital issues that we face.
And these are both correctable?
Yes, these are both correctable, and the treatment starts immediately after birth. For clubfoot, the treatment starts immediately after birth, within a week. If the baby and mother both are fine health-wise, then the treatment can be started within 7 to 10 days of birth.
Okay. And what about brittle bones? Does that also not come under your scope of
Yes,
work?
that also comes under my scope. So brittle bones are caused by the osteogenesis imperfecta. This can be a genetic or it can start de novo, and it causes the bones to be fragile, and
Okay.
it leads to multiple fractures depending on the severity of the disease.
What about prevention? How many of these conditions that we're talking about can be prevented or detected earlier in the pregnancy?
So even if they are detected in early in the pregnancy, so sometimes what happens is when we do a prenatal scan, we can see that there is a clubfoot deformity, but after the birth we can see that it is completely correctable. These are the children that are labeled as physiological clubfoot, like they had an appearance on the ultrasound scan, but after delivery it has come normal,
Okay.
right? Similarly is for DDH. So sometimes on immediately after birth, we when we examine, we find certain tests positive for a DDH, but after 6 months they come completely normal.
When you say
So
DDS, what does that mean?
it means congenital dislocation of the hip.
Okay. Right.
Yes.
And are they preventable? I mean, is there anything that expectant mothers can do, or even before pregnancy, is there anything women can do to make sure
No.
that no?
No.
Okay.
No.
These are not hereditary, also.
No. These are not hereditary. Yes.
Okay. Um, what are the disabilities that are caused? I know that you are a pediatric orthopedic surgeon, but I'm sure that you must be treating elders also once in a while, older people, adults. What are those that are caused by disease or age, arthritis, osteoporosis, or what are the other conditions that you might see in people who are older, not just in children, but people who are older?
Yes. So this is a completely different specialty, like dealing with the geriatric problems, geriatric disabilities. So the two most common things that we see are osteoarthritis caused by the age, and second is osteoporosis. That means we decrease in the bone density.
Okay.
Okay, both these are they cause considerable morbidity in the elderly population, and both of them have well established treatment depending on the presentation.
Okay. And prevention, which is what we would like to focus on the most, preventing arthritis and osteoporosis, how do we do that?
So preventing an arthritis is there are certain whenever a person develops pain in the knee joint or pain in the hip joint. So if they present at early at the age when the activities of daily living have not been reduced, so we can definitely start them on rehabilitation program, the physiotherapy exercises. We can give them calcium and vitamin supplements that can help them in preventing the severity going to reach the at that severity stage which needs a surgery.
Do you think that people come to you at the right time? Are there times when you wish that they had come to you earlier with the condition and consulted you a little bit earlier? I wish they had come earlier so I could have done something better. Are there such incidents during your
Yes, in elderly population, it's not like that. So, with whatever stage they present, then that can be treated. That has well established and safer modes of treatment. But in children, yes, they sometimes the treatment gets delayed in certain issues like infection, congenital limb problems. When they have when they reach to my OPD, then at that time I really think that something could have been done previously.
is there a lack of awareness among people and how do you think we should address that? What would be a good solution for that?
Yes, there is a definitely lack of awareness in the population. So, so we can reach to the general population by they stay far away from the city. So we can organize some health camps and free OPDs, charitable camps, so that can be we can reach to them.
When do you decide that a surgery becomes necessary? At what point do you decide that it can't be treated with medicines or exercise? And when does surgery become really necessary?
So I would, at this point, I would like to talk about cerebral palsy, in which is my core specialty. So in cerebral palsy, whenever there is a child who has reached at the point where there are multiple contractures that have developed, maybe because of delayed treatment or non-compliance, whatever the issue is. So yes, I decide to go for the surgery, and these are minimally invasive surgeries most of the times that can be corrected easily.
And are they affordable to most people, do you think? And easily
Yes,
available?
yes,
They are.
yes,
So, how
yes.
much would a procedure typically cost? Do you think the upwards of how much? Um,
See, if they require certain injections like Botox, so the injections are a little bit costly. So that we cannot cover up, but the rest of the logistics can be easily covered with arrangement with the hospitals.
and what about spinal cord injury in children and in adults? Is that part of your scope of work? And since it mixes, I think, neurological and orthopedic expertise, which is needed.
Yes, yes, yes.
Do
So the
you-
spinal cord injury is a mix of both neural as well as ortho damage, which is frequently caused by injuries, trauma, and certain times it is also caused by infections as well as metastatic cancers.
So, Dr. Vivek, is there any specific disability that you would want to talk about or a special case that has come to you? Anything that comes to mind?
Yeah, so many of these patients of cerebral palsy come to me with disabilities, and they come at a really later stage when the child has developed a lot of disabilities in the lower limb, such that it has affected the walking ability. So they are mostly bedridden or they don't have the capacity to walk. So at this point, I would like to inform to the parents that whenever you have a child that has been facing difficulty in walking, so they should immediately consult to a expert nearby which is available, and they can refer them to the specialist or however it is possible.
Okay.
And once they reach to the physician, they can be evaluated, and whatever disabilities are that have been detected, that can be corrected as per the presentation.
So the earlier the parents come to you, the better it is for the child and for the parents also to manage the
Yes,
disability.
yes. In cases of congenital issues and in cases of cerebral palsy, the earlier the child comes to us, the better it is treated.
Okay. And prevention also applies, of course, to arthritis and osteoporosis, etc. There, what would you like to say?
Yes, so osteoporosis and both arthritis are preventable. And for instructions, there are certain instructions which are different for women and as well as men. Okay, so for women, it is like once they reach a post-menopausal stage. So usually they are prescribed with vitamins and calcium supplementation that can help them. Since the period is in this period, there are decreased hormones, so we need to supplement them with oral medications, right? And other instructions would be like having a regular diet and a regular exercise, like brisk walk for at least 20 to 30 minutes daily. And for men, all these instructions, plus there will be specific instruction to quit smoking and reduce alcohol intake. So these are
Right.
two most common factors that cause osteoporosis in men.
Okay. Any message to your fellow surgeons?
So, no, to fellow surgeons, I would like to mention, like we have to be more careful while treating children. We have to have a high suspicion index to detect disability or a deformity at an early stage. And if there is anything that can be done by taking a help of another expert, that should be taken at the right time. And be more open, and it can be better.
Yeah, more approachable also, so that people
More
feel
approachable, yes.
yeah, comfortable with them. Any message, final message to parents and patients, please, from you? Closing comments.
So yes, there are certain instructions that the parents should follow. Like whenever they detect a problem, they should not wait on it. Like I have seen that Indian population has a high tolerance, so we should reduce that, and they should come to the physician as early as possible. And that whatever the instructions have been given, that should be followed. Yes.
Great. Thank you. I think it's a lot of stigmas and superstitions and the shame and embarrassment that they feel when a child is born with a disability that also stops them from talking about it. So that also needs to go. Thank you so
Yes.
much, Dr. Vivek, for
Thank you, Anita.
thank you, Team Ekansh, for the back-end support. Thank you, MKO Pharmaceuticals, for being our sponsors. And thanks to everybody who's watching this interview. Thank you again, Dr. Vivek.
Thank you.